In 2002, in an act of remarkable global solidarity and leadership, the world came together to create a global fund to fight what were then the deadliest infectious disease confronting humanity. Over the past 20 years, the Global Fund has been playing a major role in global health. The fund has proved its worth. These diseases that I mentioned kill half as many people now as they did 20 years ago. This is a great achievement that we owe to stakeholders, efforts, and public and private partnerships. However, those very significant gains are today at risk. And even before COVID-19, progress has slowed and the pandemic has set us further back. Conflicts, humanitarian emergencies, drug and insecticide resistance, but also climate change threaten the efforts made to date. The fight against these diseases can be won, but we still have a long way to go, especially in this region. Southeast Asia accounted for 45% of new TB patients and 50% of death globally. Ladies and gentlemen, 2024 and 2025 will be important years for the replenishment of the global health initiatives. To avoid replenishment rivalry over the course of the next 2 years, we have a responsibility as donors to promote partnerships and dialogue around global health initiatives. So let's invest together for a better future for all.
While strides have been made, our region still faces formidable challenges with malaria, tuberculosis continuing to threaten public health significantly. The Global Fund has played a pivotal role in propelling Thailand's strides against HIV, TB, and malaria. Remarkable progress has been witnessed, notably in HIV transmission. Thailand stands as an international leader in universal health coverage. The Global Fund support has been instrumental, focusing on community engagement. Together, we are making tangible progress in fight against tuberculosis, HIV, malaria, and other diseases.
We must dismantle silos and encourage collaborations among stakeholders, and that at all levels. The exchange of knowledge accelerates progress and maximizes impact. We must empower individuals and communities to advocate for their own rights, the rights to have access to health care, and also the rights to dignity. And the civic space have been deteriorating during the last 20 years. In some countries, actually, the only forum for dialogue with civil society organization, the only forum left is the CCM, the country coordinating.
20 years ago, or more than 20 years ago, when the Global Fund was created, it was really to fight against enormous health crises and enormous human rights crises. And here we are, 22 years down the line, having achieved together tremendous results. 59 million lives have been saved over the past 20 plus years. These 13 communities have embraced and can shape the programs that we invest in a way that best fits their needs. The Global Fund is today the largest grants provider when it comes to health system strengthening around the world. We are currently investing $2 billion a year to health systems and preparing the way also to prepare for future pandemics.
My organization, Thai Foundation, we have been the PR since round two. Round two began in about 2003, 1 year after Global Fund started. And we became PR because we wanted to work with migrant workers in Thailand, which we are very proud because it shows the mechanism of the Global Fund that it does enable civil society to have a real role in responding to the crisis of the diseases. And so we did begin with that in 2002. The year following, we did another special activity was that we applied to the GoFund again. We continue to be the PR for the migrant program. We applied for the non-CCM project for harm reduction, people using drugs. And a lot of struggle, but eventually, on both cases, the government gradually started doing, adding into these programs. But many years ago, it started with funding from GoFund, external funding, while Thais were beginning to get Thai funding. After a couple of years, the government decided, why not put ARV to Thai health insurance policies for migrants? So today, migrants in Thailand can get ARV either from the Social Security program for all workers or in the Ministry of Public Health migrant health insurance program.
There has been a noticeable increase in the access to prevention testing, treatment services, as well as improved access to ART and DOTS treatment. This is because community-led programs have a deep understanding of the communities that they serve, who may not otherwise access health services. By empowering communities and engaging them in the response, community-led programs have helped reduce the stigma and discrimination associated with it, leading to more people seeking testing and treatment without fear or judgment. The impact of the Global Fund community-led programs in the region has supported increased access to services, of course, improving health outcomes and empowering communities to take ownership of their health. There have been significant strides in expanding access to HIV and TB treatment, including increased availability in the ART and DOTS treatments. But despite the progress, challenges remain in achieving optimal treatment cascades. 1 in 3 HIV providers do not provide treatment for TB, and 3 in 4 TB providers do not provide HIV treatment. Only a few countries in Asia include TB preventive therapy in HIV guidelines. Adequate funding and resources are essential for sustaining and expanding HIV and TB treatment programs. But the challenges do persist, including stigma, limited access to healthcare, drug resistance, funding constraints, and health systems weaknesses. Most importantly, communities are seen as numbers and rather than partners, which blocks them from participating and engaging in decision-making processes. Addressing these challenges requires sustained commitment, collaboration among stakeholders, targeted interventions to ensure equitable access to quality care for all individuals affected by HIV and TB. Again, on one hand, where MSM and LGBTQI communities are part of many technical resource group and technical working groups. At the regional, national, global levels, the participation of sex workers, people who use and enjoy drugs, and young people remains limited. While progress has been made by the Global Fund, but challenges remain, including the persistence of discriminatory laws and practices, cultural barriers, and insufficient resources for comprehensive HIV responses.